I'm Kim England. I am a clinical mental health counselor. I'm a primary therapist here at Solstice. In office, and actually with horses, I really, I try and use EMDR, eye movement desensitization reprocessing, as much as I can. I think it's really effective if you can get the client to get to a place where they're not up in their head and over-intellectualized and more present with their body and sensations and emotions. And so EMDR is the approach I probably use the most, as much as I can. I'm certified in EMDR, but I also am working towards certification in brain spotting. I have used EMDR with the horses, not on the horses, but with clients and the horses, mounted EMDR. So the movement of the horse simulates the bilateral movement used in EMDR. And so I've used mounted EMDR for clients that are maybe a little less verbal in my office, that maybe need to be moving and doing something more experiential. And it also helps clients get out of their head and more present in their body, and then they just kind of start to open up with the movement of the horse. For equine assisted psychotherapy, the approach I use and that I'm trained in, I actually have certification in OK Corral, and then ventured into something called natural lifemanship, which is a more trauma-informed approach. Natural lifemanship is both working with horses from the ground and also mounted work. And working from the ground and mounted work, there's really valuable boundary setting, communication, assertive, learning to be more comfortable with assertively communicating yourself. And then up there is the mounted work, which is kind of has a mindfulness component to it, but also, like I said, the bilateral movement really helps the client process information. And also there's that relationship with the horse, and that's the relationship logic. My approach works best with clients who are, I can kind of use a diverse approach, meaning I can use more experiential with the equine work or the equine therapy work, also in office, helping them process internally whatever's going on for them in any way that works best for them. So if I have a resident that comes in who's not real super verbal, doesn't like to just sit on the couch and talk and open up, then we can find different avenues to help them along with that and get the ball rolling, or help them with that. Residents here at Solstice that I've had success with, many of them struggle with anxiety, depression, but also many of them struggle with traumatic events or experiences, but also a history of trauma and attachment, which is kind of a deeper trauma, in the sense that they struggle with trusting people in their lives, allowing themselves to connect and open up, because that's kind of scary because they've been hurt in the past. So a lot of the equine work is really great for that, EMDR, and really a relationship focus in the therapeutic. The relationship is huge there, and Solstice emphasizes that relational piece above everything. What keeps me motivated, or what I love about what I do here at Solstice, is the relational component, but also seeing the change. And it's not always right there. Sometimes it's hard to see. It takes time for it to be a real and true internal change, but that's the most rewarding part, and to see our residents move on into the next chapter in their life, and there'll be bumps along the way. That's the way it works, but I think that is the why. And there was a time in my life where I worked a lot with individuals on the autism spectrum, and you really look for even the smallest incremental change. And I think that really taught me that you find what you can build on and create successes and build on that, and then that's what the resident can build on for the rest of their life, play to their strengths.